Hello guys, how are you? Did you watch the previous video? Was it useful for you? Are you ready for a new lesson? Today's lesson is about hypovolemic shock. Today we are going to move the lesson forward in a new way. I will ask questions. You answer. Until we finally review all the points in the picture. So let's get started. Well, first we see a man with his eyes closed on the bed. Why do you think we drew the patient's eyes closed? Well done! That's right, because we wanted to point out that in hypovolemic shock, the patient may experience a decrease in consciousness. Now let's pay attention to the monitor next to the patient, which can remind us of a few points. The first one is about the patient's heart rate. What has changed? That's right. In a patient with hypovolemic shock, the heart rate increases as a compensatory response to reduced blood pressure. So, as we said, the blood pressure has dropped because the patient is in shock due to the loss of a large volume of fluid. And the third sign the monitor shows us is a change in the patient's respiratory rate. What do you think has changed? That's right, tachypnea is another sign of hypovolemic shock. Now let's pay more attention to the patient himself. Why did the color of our patient's hands and feet change? I wanted to say that in hypovolemic shock, the patient's hands and feet become cold. This way it will stick in your mind better. Pay attention to the urine bag. What is the volume of urine? Is it a little or a lot? That's right, the volume of urine has decreased. So in hypovolemic shock, we have oliguria. And finally, why is the patient connected to a packed cell? The most common cause of hypovolemic shock is massive bleeding. I wanted you to remember that this image is related to hypovolemic shock, and there is a possibility that the patient will need a blood transfusion. Okay, well done. If this video was useful to you, share it with your friends. Like this video and hit the subscribe button. Write your opinion in the comments. By the way, what would you like the next video to be about? See you next time!